Welcome to our Student Parent Town Hall. My name is Jim Duffy, and I am an Associate Dean in our College Life Office. I will be moderating today's session. Please know that we are recording this session so that we can make it accessible to those who could not join us today. Our aim for this town hall is to provide important information about our return to campus and to answer your questions. Various Gettysburg College employees and our health consultant are joining us on the call today. To begin, I'll introduce each panelist. Once all panelists have been introduced, I will ask each of them an opening question, followed by questions that were submitted in advance. We will also be taking questions from the audience. Please submit your questions through the Q&A feature. We will do our best to get to all questions, but if we do not, please continue to send your questions to fallreturn@gettysburg.edu. and visit the college website for the most up-to-date information. Let's get started. We are pleased to have 6 panelists joining us today. Julie Ramsey, Vice President for College Life and Dean of Students. Dr. Richard Keeling, Chairman and Senior Executive Consultant of Keeling and Associates. Jeff Foster, Associate Vice President of College Life. Pete North, Executive Director of Auxiliary Services. Jim Biesecker, Executive Director of Facilities, Planning and Management. And Mike Mattia, Executive Director of Intercollegiate Athletics and Campus Recreation. Welcome, panelists. Julie, I'd like to open the session with you. The college has sent out a lot of information in the past few weeks. Can you talk briefly about some of the plans to date and what students should be focused on?
Sure, I'd be happy to. Again, welcome everyone, and let me just say how excited I am to be able to be speaking to you about the opening of the college, which is imminent. We're preparing and have been preparing for many, many weeks, so we're anxious to have you back on campus. We're excited, and yes, a little anxious because we know so many things are different from the way they've been in the past. So let me talk a little bit about that. The college preparations have been focused on, again, really focused on the health and safety of our students, how to spread things out, how to de-densify, particularly in the residence halls, in the dining area, in classrooms, really virtually in every building, every activity on campus. Just the need to spread people out further than we're accustomed to. So we're taking the 6-foot distancing rule very seriously. We've installed plexiglass where necessary. We're all wearing face masks on a regular basis. And so there have been a number of things. There's been a lot of work done in the area of the health center, and how the health center will also accommodate this entire process of testing students. We can talk about that a little bit more in a few minutes. But there have been, I would say, widespread collaborative efforts across the campus, working with faculty, administrators, staff, and also students who've been here this summer and who've been working with us in advisory capacity to prepare for your return very shortly.
Thanks, Julie. Rich, the next question is for you. Can you tell the community a little bit about your background and the role you've played with the college over the past few months?
Sure, Jim, thank you. And hello all, thanks for being with us this afternoon. My name again is Rich Keeling. I'm the chairman of a company called Keeling and Associates. We're a higher education consulting and professional services firm. We've been around for about 25 years. Before that, I was professor of medicine at the University of Virginia, then the University of Wisconsin in Madison. And in both of those places, I had responsibility for the on-campus health-related programs and services for students. In the time that I've been working with college students and their health issues, we've dealt with HIV and AIDS, with norovirus infections, meningococcal disease, now of course with COVID-19. And to this work, we bring a great deal of experience in both medicine and public health to assist the college in making its decisions. So that's being our role. We are decision support. We help with the facts, provide some analysis, and assist the college's officers in making the best decisions, protect the health and welfare of everyone.
Thanks, Rich. Jeff, the next question is for you. And we are just about ready here for move-in. So many students have been interested to hear more about what move-in will look like. Can you highlight for everyone what will be different for this move-in and what students should expect?
Yes, Jim, thank you for the question. Again, Jeff Foster, I work in college life here at Gettysburg College. Thanks for joining us here today. Move-in will be quite different this year, as you can imagine, and as others have noted. We, as Dean Ramsey said, are prioritizing the health, safety, and well-being of our students, and all of our decisions really flow from that central principle. There are three main differences I think that students will notice when they come to campus. First, and there'll be more details on this, students will have to test before they move into the residence hall. So all students will report to the Jaeger Center for testing. So that'll happen before you get your key. So that's something that's very different this year. Second difference that you probably picked up on from the communications is that the structure of move-in is very different. In the past, first year student move-in, for example, has been a 4-hour process. This year we're doing it over 2 days. Upper class and returning students going from 2 days of move-in to 4 days of move-in. Again, the principle here being to give people space and distance, enable them to keep 6 feet, so we decrease the number of people who are moving into rooms, who are on the floors during this very kind of concentrated time of move-in. Move-in will also be staggered, so if you have a roommate or an apartment mate, you'll arrive within a similar time frame, but not the exact same time. We're trying to make sure that someone can move in with their move-in assistant. Everyone will have one move-in assistant that can help them. And that your roommate will come at a later time, but you'll roughly arrive on the same time frame in order to quarantine together. And again, there'll be more information about that. Third big difference this year, and I'm sure you've seen this, it has to do with the move into your room itself. So specifically, you've heard us talking about and reminding you to pack lightly this coming year. That's going to be important. Again, you're permitted to have one person with you. We're asking people to unload their car very quickly, get things into their room, unpack and set your room up later. So those are some key highlights of what's going to be different through the move-in process this year. Again, this is different. It's different for you. It's different for us. Coming back to campus is often a time to meet people and reconnect, and we're going to work to do that in those first days virtually. The RAs will be focused on getting people together virtually, and we'll have some other programs available for students to tune into during those opening days of testing when people will be largely in the residence halls.
Thanks, Jeff. My next question is for Pete. Pete, what type of changes can students anticipate when it comes to dining on campus?
Good afternoon, everybody. Like I said, Pete North, Director of Auxiliary Services. Dining is much like every place else on campus, is shrouded in signage directing people to stay distanced. We also have lots of plexiglass. Unfortunately, our seating capacities have been reduced to maintain social distancing and keep people safe. So it's not going to be quite a social center as it had been in the past. Meals will be available for students to take from the dining center. So maintain a lot of portability. Some of their favorites will have to be replaced, but we'll start to introduce more and more menu items as student schedules become a little more certain and we get a little bit more comfortable with the changes in service. It's all one direction and a lot of packaged meals that we're preparing. So we will keep the same quality that we had before, but people won't go hungry.
Thanks, Pete.
Sure.
Jim, I'm going to turn to you next. Maintaining a clean environment is an essential part of the campus return. What types of changes are facilities making to their cleaning regime?
Right. Thanks, Jim. And once again, I'm Jim Biesecker, the Executive Director of Facilities Planning and Management here at the college. Several changes have been made on campus for the fall. Cleaning and disinfecting common areas of the buildings is essential to providing safe living and learning environment for our students and our employees. Providing these we've been following the CDC guidance for years and doing this even prior to this fall. But in response to the pandemic, we've implemented what we call an enhanced cleaning schedule in all campus buildings. So So each building is equipped with hand sanitizers as they enter the building. This is consistent throughout campus, so you know where to look as you're entering your space. All residence halls with common spaces and shared bathrooms will be cleaned and disinfected 7 days a week. Larger residential facilities will receive a second disinfecting service daily. Disinfecting the high touch points is common. Common areas in the buildings, including door handles, bathroom fixtures, light switches, flat surfaces, hand railings, all the places that are more frequently touched, within a building. Our academic spaces are following a similar change in schedule, daily cleaning as well as enhanced disinfecting. Classrooms, labs, and meeting rooms will have disinfecting wipes and hand sanitizers where we ask the students and the faculty to help us disinfect these spaces before the classes begin, to wipe down your desk as you don't know if the person before you did that. And all these efforts will help us in supporting a clean, healthy, these guidelines, a healthy work and learning environment.
Thank you, Jim. Mike, the last opening question is for you. The Jaeger Center is such an important part of campus. Can you talk about what changes are being made to the facility and what do students need to know about accessing the building and equipment?
Thanks, Jim, and just want to let everybody know how excited we are to have everybody back on campus. The campus has been too quiet for too long, and we're looking forward to that shot of energy that the students bring. So the Jaeger Center will be open along with the pool. It's going to open on August 24th, and it will be scheduled to be open for 7 days a week. We've removed a bunch of equipment from the Jaeger Center to comply with the capacity guidelines of the state. We also spaced out the remaining equipment that's in there 10 feet apart from each other, also to comply with some of the physical distancing recommendations that are out there. And we placed some barriers, especially in some areas around the cardio equipment where we can't quite get it to be 10 feet apart. There is a tent of the many tents that are going to be on campus. You'll see on the pool patio where we'll be conducting fitness classes and also some spin classes as well. Now you will need a reservation to enter into the pool and to get into these classes, which can be found on IM Leagues, and you'll have plenty of instruction on how to access that and set up those times and when the schedule for when those classes will be taking place. During the week, we will close for an hour in the morning to do a deep clean, and then on the weekends we will also close for an hour in the afternoons to do a deep clean, and all of those hours of operation will be on our website. As always, and which has always been the case, even prior to COVID-19, we are asking you to wipe down your equipment after each use, and there'll be plenty of sanitation stations placed throughout the Jaeger Center in order to do so. Though there will be no sharing of any common equipment such as bands, stretching bands, foam rollers, medicine balls, things of that sort. So we do ask that you bring your own if you want to utilize them. And we do have a team shop also on our website to order some of those items if you would like. And the last thing is that locker room space will not be available. So we ask that you come ready to work out and get right into your workout when you come to the Jaeger Center. And again, we'll excited to see you and looking forward to having you around our building.
Thanks, Mike. I'm going to stay with you here for a minute. One follow-up question that's tied to some of the things that you talked about. Will campus recreation and club sports take place?
Yep. So club sports competition has been suspended for this fall semester. Now they will be able to still engage with their teams with a lot of mitigating factors in place. And I know Cindy Wright, who oversees our club sports programs, has meetings set up later this week with them to give them more details. With campus rec programming, it'll look a little different than it has before, but it will take place. We're going to start out slow, and a lot of the activity, most of the activity is going to happen outside. That's going to start out with some one-day events initially, and followed by some small group competitions as we move along in the semester, like a tennis or pickleball or volleyball, things of that sort.
Great, thank you. Jim, I want to turn to you. Both Mike and Pete talked about some of the changes that are being made to provide for physical distancing. What changes have been made to better accommodate physical distancing across campus?
Yeah, thanks, Jim. A lot of changes. I mean, the moment you walk on campus, you're going to see the changes that have happened in almost every space on campus. Capacity reduction is the main part. Classrooms, dining, library, building lobbies, lounges have all seen the furniture removed or reduced, not all removed, but reduced to reduce capacity. Movable plexiglass barriers have been installed in the classrooms at the faculty teaching areas. Room capacities are also going to be posted in each space. So you know exactly how many people should be in that room, regardless if it's the lobby of your residence hall or in the classroom. We've installed signage to direct traffic flow in and out of the buildings and down the hallways, signage to remind us all about social distancing and wearing a mask and washing your hands and monitoring your symptoms. We've also reduced density in the large first-year residence halls, but there's more of a focus on a ratio of students to fixtures within the bathroom. So we do 5 students to 1 fixture that has helped us reduce the capacity in those spaces. And all these go to contribute to a safe living and learning environment for us.
Thanks, Jim. I appreciate that. Rich, I'm going to turn to you now. Jeff alluded to this in his opening remarks, as did Julie. We are going to test all students as they return. Can you provide a little more information about the college's testing plan and how often we will test students?
Sure. Thanks, Jim. So as Julie and Jeff said, we will be testing every student when they return to Gettysburg. That will be done through a very elaborately conceived and carefully constructed system that depends on both the Student Health Center and some people brought in from elsewhere to make sure the testing happens effectively and efficiently using testing supplies, which the college has effectively secured. That test will be returned in 24, 48 hours. In the interim time, students who have been tested will be quarantined in the residence hall till the test comes back. Once the test comes back negative, students will be released from that quarantine. Obviously, a student who had a positive test will go into a longer-term quarantine space. We will then retest students only about 5-6 days later in order to pick up anyone who may have been infected with COVID-19 in the days just prior to coming back to Gettysburg. And we will emphasize in that retesting first students who come from states which have had recent surges of the virus, so-called hotspots, and then all the rest of the students as well. So that happens on entrance, 2 phases of testing. After that, there will be 3 other kinds of testing. One is that through the Student Health Center, there will be testing of students who have symptoms suggestive of COVID-19 in order to determine whether that's what happens or not. Secondly, there will be testing of students who are identified as close contacts of someone else who has COVID-19, the usual less than 6 feet contact for more than 15 minutes. So we'll test students for that reason. And then third, very importantly, there will be surveillance testing, which means that ongoing after the opening tests, we will continue to test students at some intervals for the rest of the semester. Those intervals to be determined by the results of the first test and by what turns up in the symptomatic and contact testing. However, we anticipate that students should expect to be tested several times each once they come back to Gettysburg.
Thanks, Rich. And just a quick follow-up question. You used the term quarantine. We've also heard the term isolation. Can you just share what the difference is between those two for the audience?
Certainly. So quarantine and isolation are in fact different things. Isolation is a higher degree separation from everybody else. Isolation occurs when someone has been shown to have COVID-19, mostly because of a positive test, sometimes because of symptoms plus a positive test. And students who have that condition will be in isolation, meaning they will be in a room with a private bathroom, not allowed to leave that room until the symptoms resolve, until the fever goes away, and until the time has passed sufficiently since the probable time of infection. Quarantine's a different matter. Quarantine is separation for a shorter time, typically, of students who are waiting to find out what test results show. So students coming back typically would be placed in quarantine until the initial test results are back. Later on, though, quarantine may look different. That is, quarantine could occur for students who are waiting for a test result after a contact, or it could occur because students have had a level of contact that creates particular risk that we're not sure about. In general, quarantine just means that students have to stay in the room, wear a mask when they leave the room mostly to go to the bathroom or to pick up food from outside. Some students who have higher level risk may be required to behave more or less the way students in isolation would, just to protect the rest of the community. So there's isolation, very restrictive, quarantine, less restrictive, but still pretty restrictive. And then this high-risk quarantine in between, in which students will have to act more or less as though they would in isolation.
Thanks, Rich. I appreciate the details on that. Julie, I'm going to turn to you. Much of what we've already talked about today is covered in the pledge that the students were asked to sign. Can you talk a little bit about how the pledge will be enforced, and does it apply to those living on and off campus?
Sure. I think the most important thing probably to recognize is that in terms of enforcement, the first step is to educate students, to help them understand what we're asking them to do and why we're asking them to do that. And I'll just reiterate, you've heard about all the physical changes that have been made on campus, and the pledge really addresses the behavioral changes that we all need to engage in, including students. And I just can't emphasize the importance of this enough. So they're very basic things. We talked in the pledge about wearing masks, that we really need to wear masks the vast majority of the time, both indoors and outdoors, except when we're eating or exercising. Those are the two exceptions, but really we need people to wear masks a good bit of the time, especially especially indoors, but really both indoors and outdoors. That's number one. Number two, we've asked them to practice this, what we call physical distancing or social distancing, staying 6 feet apart from other people, especially indoors. That's very, very important. And the third piece is we've asked them to practice good social hygiene. Jim talked about wiping down the chairs and the desks and so forth, or Mike mentioned the equipment in the gym. And so we want students really to be washing their hands frequently and being very mindful of their personal hygiene and the space around them. Then finally, we're asking students to do the testing, participate in the testing and the quarantine and isolation that Rich talked about. I guess one last thing I would really emphasize is the importance of avoiding large social gatherings. So we know from all of the news that we've read over the course of the summer that large social gatherings, particularly of young people, particularly with alcohol, often have turned into what are called these super spreader events. And obviously that's the last thing we want to have on campus. So we are really, really focusing on how to keep those kinds of activities out of our environment for this period of time. So those are the key basic 4 or 5 things we're asking students to do and to change from a behavioral point of view. And why? Because these things work. The research, again, what we've seen over the summer is that when people practice these basic hygiene and social practices, that the spread of the virus is significantly mitigated. And that's what we're looking for. That's going to be the key to allowing us to complete the semester. And without student cooperation, without student participation, we, quite frankly, might not be able to complete the semester in residence. So that is our goal, and that's why we've framed things the way we have for students.
Thanks, Julie. Rich, I want to jump to you real quick. Julie mentioned the importance of wearing masks. Can you just describe what an appropriate mask is?
Sure. The mask we're talking about is the cloth face covering that most of us have gotten used to over the past several months. That is, it's not sufficient on the one hand to use something that doesn't completely cover the nose and mouth, such as a bandana. On the other hand, it's not necessary to have something as sophisticated as a medical and surgical mask that a dentist or dental technician or physician might wear for a procedure. We certainly don't need to use things called respirators, N95 so-called respirators, which are highly protective but are reserved really for first responders, healthcare personnel, and public safety people. So the cloth mask that we've gotten used to is what people will need.
Great, thanks, Rich. Jeff, I'm going to come back to you with a number of questions, related to move-in and student arrival on campus. So, first question is, what should students be bringing? You're on mute. There you go.
That's a good question, one we've been receiving a lot. Thank you for bearing with me there. First, I'll say that the Residence Life Office has a web page that has some guidance on what to bring to your residence hall room, so I would direct you there as a starting point. I already mentioned the need to pack lightly. If there's something big or heavy that you might normally bring, just leave it at home. The reason for that this year is that we do want to be positioned that if circumstances were to change in the future and we would have to move students, or if we would have to send students home because of a significant change, we want to be able to do that quickly. So again, packing lightly will help support that. It also will help you move in quickly as well. We've talked about having a to-go bag of essentials. And what we mean by that is having a small bag with some personal items, a couple of days worth of clothing, ready to add your course materials, charging cords, laptop, and be able to move quickly if we would need to do that. We're still anticipating we may have to relocate some students on short notice, and that will help us to do that quickly, to have kind of a grab bag ready to go at all times. I will share with you, the college at check-in, every student will receive an arrival packet, and in that arrival packet, you will receive 2 cloth washable, reusable masks, a few single-use disinfectant wipes, a small bottle of hand sanitizer. In addition to that, I would advise you to bring your own hand sanitizer, bring your own cleaning supplies as well to take with you to class, to have with you on your person, to have in your room. So please, I would encourage you to bring those items as well. If you left campus in March and you stored items with the college, your items have been stored in the attic or the former Agway building. And when you come back to get those belongings, those buildings will be open during move-in, and you can report to those locations to pick up your belongings at that time. If you need to make special arrangements to get belongings at a different point, contact Jim Biesecker, staff and facilities for assistance with that. The last thing I'll say is, as I saw a question on this, who should come with me? I said before, you can have one move-in assistant with you. What I mean by that, again, in trying to keep the number of people in the res hall rooms and the residential buildings low, we ask that every student only have one other person entering and present in the residence hall with them at any given time. So if you bring a couple of family members with you, we would just ask that the additional family members remain outside of the building. You can switch out. The goal is just to have one person with you as a student through the move-in process.
Thanks, Jeff. And how long does a parent have to help their student move in to set up their rooms?
We're asking people to try to keep the move-in, getting belongings into the space and set up to a few hours, if at all possible. Again, we have staggered the arrival based upon the testing model. We'll be bringing about 30 or 40 students in every 30 minutes to campus through the course of next week. So as we bring more students in, we're hoping that other students will be done unloading and unpacking, creating space for other families to pull in and unload and to keep the building density down. So a couple of hours, 2-3 hours to set up, and then we would ask that people move along to allow other students to move in.
Right, and then you're leading into the next question, which is, are parents expected to leave campus immediately after move-in?
Yeah, unfortunately this year, yes. We typically do well. We have a welcome day. We involve students. We involve parents. This year, we're not in a position to do that. So once students do get situated with their families, we would ask that the families do depart campus so we can continue to test and move other students in. We are trying to think of ways. We do want to continue to remain engaged with parents. We're trying to think of some ways we might do that once the semester begins, if families do have questions about student experience here on campus.
And final question, Jeff, and you started to touch on this a little bit on what past move-ins have looked like. Do you anticipate that the first years will be able to experience the traditions like first year walk and convocation at some point?
That's a great question. I don't know the answer to that yet. We're kind of evaluating. We do know that we're not going to be able to do the first year walk as we open the campus this semester. We know we won't be able to do convocation. We do have plans for a different type of much smaller event for students to welcome them to this community, to formally welcome them into our community. And so the students on the orientation schedule, we look out for that. We are still going to try to keep some traditions in the move-in and orientation process, not what it typically will be. If there's an opportunity to do the first year walk or something similar in the future, once circumstances change, we'll certainly revisit that. But at this time, we don't have plans on that, given the many unknowns that we're looking at in the coming months.
Thanks, Jeff. So we've talked about testing, we've talked about moving in, and Pete, I'm going to turn back to you now for some more questions about students while they're on campus, food in particular. Will all of the dining locations be open?
Yes, all of our locations are targeted to be open. We've got a lot of planning, new menus. We've also added the ballroom as additional seating, but it will also have some food that students will be able to get while they're in there as well. We've added additional seating in both plank, the the ballroom rather, a tent on Memorial Field, and the patios, specifically the atrium and bullet hole patios as well. In addition to that, we've also added the atrium will be available for student dining. You'll notice for the upperclassmen returning, kazooie has been moved over there, so sushi and rice and noodle bowls will be available over there, as well as other selections for the board program that we're bringing into the atrium. I think more importantly, we know we have a number of students returning and joining us this year that may have special dietary restrictions and needs. Smart Eats is still going to be available, and students should check in with the chef for that area. We want to make sure that we connect with you and get any dietary needs that you have squared away. And so Smart Eats will still function as that place.
Great. And a couple of quick questions here. Do students need to make a reservation?
No, reservations are not required. We are looking at possibly using some other technology that would involve virtual queuing. Probably wouldn't introduce that right away. We are in the final stages of testing a order ahead app, and we'll reveal those once that's done. I also wanted to mention, we also added in our partnership with the Gettysburg Hotel, Starbucks in the hotel, and the hotel itself will also be available to students. So we're kind of expanding what we're actually doing and making more food available.
And final question for this round. Oh, Julie, did you want to share something?
I just wanted to jump in. I think that several people have mentioned tents outside, both for classes, for social activities, and for dining. So I think when you think about what to bring, you should be prepared to be spending more time outside and enjoying the beautiful surroundings of Gettysburg. So think about that when you do your planning.
Thanks, Julie.
Sorry, Jim, to interrupt you.
Not at all, not at all. Pete, one last question this round, which is how will students get food if they're quarantined or isolated?
So if you're in an isolation or quarantine room or restrictive quarantine, we will be delivering food to you. We've worked with the health center and have developed a form for any student who is being isolated or in a restrictive quarantine. They can go online through their credentials and order meals and we will deliver them to you.
Great, thanks, Pete. Julie, I want to come back to you and Rich in particular. We're starting to get quite a few questions about testing since we've had our testing conversation. So I want to address those. How can we be sure that tests will be back in 48 hours?
Well, we're working with a company called CSI, Contamination, I'm blanking on the name, Contamination Source Identification, thank you. CSI is how we refer to it. Company in Western Pennsylvania, and we have worked out an agreement with them. They will send a courier to pick up the tests on a twice-a-day basis, and they have promised that they can turn them around in short order. And we are actually testing that process today for the first time. So I'm based on everything we've heard so far. Now, things can change, but we've intentionally selected a company that is relatively small and has taken great pains to, I would say, restrict their business so that they are not overextended the way so many companies are that we read about and hear about in the news. So I have considerable confidence in our testing partners.
Thanks, Julie. And Rich, can you just share, we got a question from the audience about what kind of tests we were using? Like, are there any more specifics from a medical perspective that you'd like to share?
Sure. This test is what's called a molecular test. That is, it's a test in a genomic sense, for parts of the genome of the virus done by a polymerase chain reaction technique. This is an FDA-approved, very standard test for COVID-19.
Great, thanks, Rich. And two more questions for you in this round here. Why isn't the college using rapid tests?
We actually are probably using the most rapid, reliable test that can be done, which is this 24 to 48 turnaround. There are tests available for point of care testing that promise results in 15, 30 minutes, but they have significant challenges with false negatives. We're not willing to take that chance. So we're using the best test we can that produces the most reliable results.
Thanks, Rich. And one more question before I move on to the next panelist. What specific factors will be monitored and employed to make the decision to close Gettysburg College for in-residence education as was done in spring 2020?
Sure. We've identified a number of factors, some of which relate to the pandemic itself and to the spread of the virus, some relate to the academic or experience that students have on campus. Related to the spread of the virus, we're obviously monitoring students who become COVID positive, but we're also monitoring the trends in which that happens, the patterns in which it happens, the capacity that we have to use quarantine and isolation spaces, the availability of testing, sufficiency of staff in the health center, et cetera, a variety of on-campus parameters. But we're also watching very closely what happens in Gettysburg itself and in Adams County in Pennsylvania, in the surrounding regions, to try to make sure that we are aware ahead of time of any trend that could endanger our campus community. Right at the moment, Adams County is doing better than the rest of the state of Pennsylvania in general in all parameters about both test positivity, numbers of cases, death rates, et cetera. But we're going to watch that very closely. And finally, we're watching the quality of the student experience on campus and our ability to deliver the academic program with the excellence that Gettysburg's known for. And there'll be a variety of ways of assessing students' reactions and how students are doing, as well as how the program's being delivered. If anything happens that makes this experience less than what Gettysburg promises, then we'll rethink what we're doing.
Great, thanks, Rich.
Yes, I'm going to jump in again. I think people may be interested in knowing what kind of tests we're using. And the initial tests are the mouth swab test. So it is not the one that goes up into your brain. It's done in the mouth, the cheek, tongue, the back of the throat, and it will be administered by a clinician. And
it's not an unpleasant test to go through.
Yeah, sighs of relief, I'm sure, from the audience. I'm going to jump around a little bit now, folks, because we've got a variety of questions coming in on different topics. Jim Biesecker, I'm going to start with you. Could you comment on ventilation, especially in the smaller classrooms and, of course, the residences?
Yeah, I can do that. We've assessed our systems as we get out into the summer here. systems on campus. We have many different types of building systems ranging from residential to more commercial. Our commercial systems are what you typically find in our academic and administrative buildings and small offices, and some of our residence halls that have AC are obviously more residential. Because of this variety of systems, we work closely with our building engineers to assess the systems and to make sure the commercial systems were operating as designed. We're exchanging the proper amount of outside air into the system for the capacity and for the type of building that it's supporting. Our college staff then went through and did our routine maintenance on the systems, which included changing of the filters. So all those things went into making sure that all of our spaces on campus are well ventilated and safe and ready for the fall semester.
Great, thanks, Jim. Mike, I'm going to come back to you. Two questions related to your area. The first is, what is the update on fall sports, and when will we know more about winter and spring sports?
Yep, so fall sports at this time are suspended, and a decision on when all sports, winter, spring, and potentially what fall will do is right now scheduled through the Centennial Conference to be decided at the end of this month, at the end of September, I'm sorry. And the whole point there is to see how our systems and processes are working on campus, seeing how the students are reacting to what Rich was talking about earlier, and seeing what the factors are throughout the rest of the country and with our other Centennial Conference opponents and what's going on in their campuses. And then the Centennial presidents will get together and hopefully decide what's going to happen there in terms of us being able to resume athletic competition.
Great, thanks, Mike. And just a quick follow-up to that. Will there be intramural sports this year?
Yes, there will. As I mentioned earlier, that it'll look a lot differently, and the different types of sports will be different, and all the mitigating factors. Maybe we might not be able to do pickup basketball or have a basketball tournament, but we may be able to do a pickleball or a tennis tournament or something else outside. So there will definitely be intramural sports. It's just going to be a little different than it had been in the past.
Great, thank you. Julie and Jeff, I'm going to turn to you now. We're getting a number of questions that are, I would say, testing related, move-in related, and so I want to go through a few of those. Julie, let's start with you. If my son tests positive, can he come home or can I stay with him in a nearby hotel for quarantine period?
It's a great question. We certainly will make it possible for people to take their sons or daughters home if that's what they would prefer and that's what they're able to do. The one about the hotel, I'd want to have some conversation with parents about that and the advisability of doing that. I mean, I don't think that's what we would recommend. On the other hand, we're not in a position to say that you can't take your son or daughter somewhere, but I think we would recommend that they stay in a less public venue. So it's something we'd have to talk about, but definitely they can take their sons and daughters home. And of course, we will also provide, as we've been mentioning, isolation spaces if they aren't unable to do that.
Thanks. Jeff, we've got a question from a parent of an incoming first-year student. The question is, does the student have to report for testing at his appointed time or sooner? And how sooner, if so?
Good question. As I said earlier, we have a very coordinated scheduled process. So we would ask that all students report at the designated time. If for whatever reason that time doesn't work for you, you can call the Office of Residence Life to talk about that. But again, we are trying to minimize the number of changes and we're trying to keep to the schedule. Would encourage you to report precisely at the designated time.
Thanks. And this question, either Julie or Jeff, for you, how does a close relationship, i.e. a significant other and very close friends, fit into the mask, distancing, and room policies?
I would look to Rich for his guidance on that, but I'm assuming that there are no exceptions.
That's correct, no exceptions.
All right, thanks. Jeff, can students go to Target or the surrounding areas to pick up items?
Oh, it's a good question. And again, one that we've received. Yes, we do want students to, as much as they can, to stay within the campus and the local area. We do understand, however, particularly during the move-in timeframe, students and families need supplies, need things to get started. So yes, if the closest Target is in Hanover, for example, if students need to go to Target in Hanover to pick up some things, that's fine.
Thanks, Jeff. And Jeff, I'm going to stick with you because I think this might be a good time to talk a little bit about our use of the Gettysburg Hotel this upcoming semester. We've had a number of questions about these. So what can students assigned to live at the Gettysburg Hotel expect?
Right, it's a great question. Yes, we are housing students in the Gettysburg Hotel this coming semester. That's about 230 students who will be residing in that space. Jim Biesecker and his facility staff, along with the residence life staff and others, we've been working to make sure that space, its features and amenities align with what students could expect in any of the residence halls on campus. Some of the specific things that students can expect: the building is air conditioned, has Wi-Fi. Every room will have 2 beds, 2 desks, 2 chairs, the standard kind of deployment of furniture. Students will have card access to the building. It's not on the college's ID card system, but students will be assigned a card to access because the building will be secured and locked like the rest of our residence halls. We will have RAs present. 3 RAs will staff the building. Public safety will respond to the hotel to support students upon request, just like they would at any other location on campus. We're also going to have a security staff member, a contract security person in the hotel in the lobby area to assist as well. So we're trying to structure it in a way that is consistent with the student experience elsewhere on campus. I should add a couple of other things that are important to students. Laundry, we're adding a laundry room on the main level of the hotel, so there'll be laundry on site. I should note that that laundry system will not be on the college's card system where students can pay electronically. You will have to use coins. So if you are coming to campus in the hotel, you may want to bring some coins. The hotel desk will also have change to assist you with that. There is a bike rack in the back of the hotel, and we are working to make sure there's sufficient bike rack space there for students. The other big question students ask about is parking. Students can bring cars. We will need students to park their car in the main lot on one of the main lots on the campus. There is a parking garage adjacent to the hotel, but that parking garage is owned and operated by the Gettysburg Borough, not by the college. Students or anyone can purchase a monthly parking pass at the Borough Garage, so students are welcome to do that, but the college-provided parking will be on the main part of campus.
Thanks, Jeff. Pete, do you have anything to add related to the hotel experience?
Yeah, I've seen some questions about the meal plans at the hotel, and yeah, students can use both their meal swipes and bullet bucks or dining dollars there. So that shouldn't be a problem for them. Students who are during their first week quarantine will still get meals at the hotel, and then they're certainly welcome to come to campus after they've quarantined. They have the quarantine in place. And then, during the academic year, they'll have, they're not restricted to eat there. They can come to campus. Other students can go there as well, as long as they're maintaining the required distances. So the hotel is having several spaces, understanding the distancing that is required, but that is an option as well.
Great, thanks, Pete. Julie, I want to ask you a few questions about student care. So we've been talking quite a bit about preparation, logistics, everything that goes into getting the year started. But I've got a few questions for you related to if a student is sick. So for instance, can the local hospital help with sick students?
Yes, I mean, obviously we would, we send students to the hospital when we feel that they need hospital care, where they need to be seen by a physician and they may need a different kind of support. We've been in close contact with the local hospital, which is part of the WellSpan system. The Gettysburg Hospital, for those of you who don't know, is about a mile from campus. We have very good communication with the hospital, and they are part of a larger system. So if a student needs to go to the hospital, we will get them there. We will either transport them or call an ambulance We will, when students are in isolation, or if they, at any point in time, actually, if they call the health center, obviously we will figure out, do our very best to figure out whether it's COVID, whether it's something else. I mean, obviously we've transported students to the hospital many, many, many times. Every year, I hate to say. There are accidents and various illnesses that students contract. I think probably the other thing that's important to say is that the hospital has, when they've been doing their planning and their modeling on COVID and how to take care of the community, whether they have adequate resources to take care of the community, they have always factored the college population into their modeling. So in terms of thinking about, do we have enough ICU beds? Do we have enough ventilators? Do we have enough PPE? They've always factored in the student population and the entire college population into those models.
Great. And just a follow up to that, likewise, how could you share a little bit about what our health center has done on campus to prepare for the return of students?
Sure. So probably the main couple things that are significant. We've added staff. That has been important to do. We've added a care manager who's an RN to our staff. We've added a medical assistant, and we are in the process of adding some contingent folks as well, LPNs or other RNs to assist us with the testing process. So there have been some staff changes. There will be some hour changes. The health center will be open on weekend afternoons, potentially some evenings if necessary, so the hours will be extended. The health center itself has undergone some physical changes. There are 2 negative airflow rooms that have been created to assist with testing students in the health center itself. There will be no fee for access to the health center. There has been in the past a kind of the same kind of fee you might pay when you go to visit your doctor. We'll be waiving that for the entire year so that there is no charge for the visit. There might be some charges for labs and things like that, but not for a regular visit or the COVID test.
Great, thank you. Pete, I got a group of questions for you that came in back to back. So two related to mailing, actually. Number one is, what is the mailroom situation?
Okay, so the mailroom should operate normal hours. We've installed plexiglass barriers, and tomorrow we should be installing touchless kiosks. So students will have to queue through lines to get to the package and mail window. If students can bring things with them rather than having them shipped, that would help a lot. We anticipate that there may be some delays in receiving packages and mail, but we will get it delivered to you or have them for you. It should be a very safe process. We've added actually more lockers so that there's another touchless program, but students will bring their ID card, they'll tap a reader, the clerks on the other side of the plexiglass will be able to locate their package. The student then taps it again and the package is signed out and we hand it to them. So no big changes there, only a very different process, that's all.
Great, and a follow-up to that, specifically related to textbooks. Any changes to textbook pickup?
Textbook pickup is still, if you reserved your textbooks, will be in Cub 126 for pickup. And if you're looking to purchase, just enter into the bookstore. There will not be any textbook rush, as we used to call it, in the ballroom. It'll all be handled in store.
Great, thank you. Mike, I got a few athletic questions here back to back, so I want to follow up on these. First question is, what will the teams do during the fall if there isn't competition?
Yep, so they'll be able to engage in some athletic activity. Obviously, there's going to be plenty of mitigating factors, and we've taken into account all the recommendations from the NCAA, the CDC, all the state and local government recommendations as well. We're going to start off in smalls. groups and progress slowly through a phased-in approach from an athletic activity standpoint. Also, our teams will continue, as they always have, to be able to interact with their coaches and teammates through their well-being, their personal development, and the leadership programming that they always have in the past as well, either outside in a very physical distanced way or continue to do virtually as they have been throughout the course of the time.
Thanks, Mike. And I think you inherently answered this question, but I just want to ask a specific follow-up. The question is, if sports are suspended, so let's say they're suspended for the year, will the training be suspended as well, or do you think it'll be similar to the plan that we have right now?
Yeah, we'll continue on the plan, and as I mentioned, there's a phased-in approach. Initially, it's very small groups working out in a socially distanced way, and depending on the factors on our campus, we'll determine whether or not we can move into other phases and increase the type of activity that we're going to be able to do. So, depending on what's happening on our campus, will determine how much physical and athletic activity we can have.
Fantastic, thank you. All right, panelists, we have about 10 more minutes, and so the goal now will be to get through the remaining questions that we received from the audience. Julie, the first one is for you. Can you clarify the visitor policy? Can parents visit students? Can students return home to visit parents?
Unfortunately, no. I'm sorry to say that the policy that Jeff mentioned earlier, we're asking students to remain in the Gettysburg area, the immediate area, and not go home. That is why we have canceled essentially the fall break, and why we are trying to get students home before Thanksgiving, is to eliminate that sort of coming and going that happens very naturally in a normal time. This is not a normal time. So we've asked, we will also limit visitors to campus to those who are essential to the college's business. So we're not hosting family weekend, alumni weekend, things like that are also have been canceled for the same, or postponed, I guess, for the same reasons. So we are not encouraging or permitting students to go home or have family visit them here.
Thanks for that clarification, Julie. Jeff, I've got another question about the hotel. Folks are curious to know where they can park and unload during move-in.
Yes, the hotel sits on the square, as you know, and in front of the hotel, there are a number of metered spaces. The college is working to reserve some of those metered spaces for move-in days so that students and families can use some of those spaces. The other location is behind the hotel in Racehorse Alley, between the hotel and the borough parking garage. There's a small space there where maybe 3 or 4 cars could unload. So we'll be working to direct students and families as you are moving in to unload in one of those 2 areas.
Great, thank you. Jim, I'm going to turn to you. We have a question about transportation. Will transportation still offer cheaper group shuttles to and from the airports and train stations?
Yes, Jim. I mean, we will be operating what I call like a modified schedule this fall. So you know, students returning to campus will be running the shuttles to go bring people back to campus and then take them to home at the end of the semester. But as Julie said, you know, we're really encouraging everyone to stay on campus. So we'll not be running our typical traditional shuttle systems all fall. When you do operate and do ride our shuttles, the vans are set up to be physically distanced. Our large vans will hold 2 people plus a driver. The proper PPE will be given to you as you hop in. If you don't have your mask already, there'll be hand sanitizer available, and then the driver will drop you to campus like normal. But like I said, you will not be able to reserve transportation throughout the fall.
Great, thanks. Rich, I want to turn to you. I've got a question, but more so, I'd like to know your thoughts about how we as an institution have prepared for this. Kind of your thoughts about that, and what may make us different than those institutions that have already decided to go remote.
Sure. So we've been engaged with Gettysburg as it has thought through these very complicated questions and made these very difficult decisions about reopening and how to do so safely since sometime in early May. And throughout that period, the senior officers and the committees established at Gettysburg have been particularly diligent and rigorous in their investigations, their risk management, contingency planning, and in the ways they have prioritized health and safety for students, faculty, and staff. Gettysburg has done this earlier and better than most other institutions have done it. And they've done it in a way which has been particularly serious, asking all the way up until very recent days the question, should we change? Should we change our policy, change our plan in relation to the various indicators that we talked about earlier? The situation that Gettysburg is in has some geographic advantage. I mentioned earlier the relatively smaller impact of the virus in Adams County. We know also that students come from lots of places, faculty and staff commute from other places, so we're not taking that as any sort of false assurance. But what Gettysburg has planned to do is to put in place risk mitigation strategies which pertain to the very best science available, not to politics, not to wish fulfillment, but to the best science available. And I feel confident that those strategies that the college has chosen will enable it to provide a safe experience for students in the coming semester.
Thanks, Rich. I appreciate that. We're just going to ask, we'll go with 3 more questions here. Julie or Jeff, this is a question from a commuter. I'm planning to commute to the college. When should I take my COVID test?
Jeff, there's a specific day, I believe, that's been designated for commuter students. Is that right?
Yes, you should have received, all commuters, all students should have received an appointment time. If not, please contact the Office of Residence Life or email them at residencelife@gettysburg.edu. You can work with them to identify and ensure that you have a time and that you have it confirmed.
Great. And 2 questions for Rich and or Julie related to quarantine. The first one is does a student have to quarantine each time they're tested?
No, students have to quarantine the first time when the initial testing is done for everybody. They don't have to quarantine on the repeat testing. The quarantine that would be necessary if there are close contacts has to be maintained through the quarantine period or until 2 tests are returned negative.
Thanks, Rich. And the second question there is, can students go outside during the initial quarantine?
We are taking a pretty serious view of this. We want the community to be as safe as possible. So we're going to be asking students to make a significant sacrifice and stay in their rooms using only the designated bathrooms. We come downstairs or outside to pick up meals, but not to otherwise walk around campus until they're cleared.
Great, thanks. And Julie, before I close the session today, anything else you'd like to add based on what you've heard today?
Sure. I would just like to reiterate, I think you have a sense both of the kind of serious planning that has gone into our decision to return to residential life. I think you understand what is being asked of you all, both parents and students. And I guess the last thing I would say is just recognize a couple of things. One is that we're not expecting that we will not have any cases of COVID. We are not expecting to be COVID free the entire semester. Would we like to be? Sure, we'd be thrilled. But that may be an unrealistic expectation. What our goal is to prepare to try to prevent the spread as much as possible and to engage in, as we've been saying, very strict mitigation processes. So that's number one thing. I don't want you to be shocked or disappointed or any of those things if and when a case arises. And I think the second thing I would just say is things have changed. Things are different. It's all new to all of us. None of us have ever done this before. So I would ask for your patience and your flexibility. As we go into this, there are going to be bugs in the system. There's no question about it. But I think with some good humor, some patience and flexibility, we can all get through it beautifully. And I really count on our students and our faculty and our staff being able to rise to the occasion to make this a really successful semester. Thanks, Jim.
Thanks, Julie. And that's a great note to end on. So I want to take a moment and I want to thank everyone for joining us. A special thank you to our panelists for their time and continued work towards our campus opening. If you did submit a question and it was not answered, please remember to send it to fallreturn@gettysburg.edu. Please continue to check the Better Together website for updates, correspondence, and general information. The site is updated each time we have additional information to share. Enjoy the remainder of your day.